Madam Chair and members of the committee, thank you for allowing me to testify today on this critical issue. My name is David Bagot. I'm a pharmacist and owner of Petersburg Pharmacy in Petersburg, Illinois. I'm also the president of the Illinois Pharmacists Association. The stakes are higher than you might think. This isn't just about pharmacies or patients, as those stakes are enormous. Pharmacy benefit manager practices are driving up costs for employers buying insurance, straining federal, state, and local government budgets, burdening taxpayers, and undermining healthcare quality across America. I'm here to urge you to vote for the Prescription Drug Affordability Act and to see through the misinformation campaign being waged by PCMA and other allies of these vertically integrated monopolists. Some groups, perhaps unknowingly, have echoed perspectives shared by PBMs without seeing the broader impact on patients and providers. So who are we dealing with here? The three largest PBMs tell you everything you need to know. OptumRx, owned by United Healthcare, is number 4 on the Fortune 500 list. Caremark, owned by CVS Health, is number 6. And Express Scripts, owned by Cigna, is number 16. These vertically integrated conglomerates have one overriding goal: maximizing revenue and profits at any cost. Here's their playbook. When the Affordable Care Act required that 80 to 85% of premiums be spent on patient care through medical loss ratios, these companies found a loophole. They merged vertically with insurance companies and pharmacies, creating a rigged system where they pay themselves vastly different rates than independent providers. As a pharmacy owner, I see this firsthand. PBMs routinely reimburse my pharmacy below cost for brand name prescriptions, medications where they're already pocketing massive rebates from drug manufacturers. Meanwhile, they pay their own affiliated pharmacies, including PBM-owned community, mail order, and specialty pharmacies, much higher rates for the same medications. PCMA will tell you all rebates are passed through to payers, but when asked to prove it, they claim rebate information is proprietary. This bill will require PBMs to show where all the cash from drug manufacturers is actually going. This isn't inefficiency, it's intentional exploitation. Those inflated payments to their affiliates count as patient care spending for medical loss ratio purposes, while just moving money from one pocket to another. They profit twice, once from the hidden rebates they keep, and again from the artificially inflated reimbursements that help meet their regulatory requirements. The result? Higher premiums the following year, increased profits for the conglomerates and their shareholders, and shrinking payments that drive independent healthcare providers out of business. Healthcare costs would naturally rise with inflation like other goods and services. Instead, because greedy monopolists control our payment systems, we see double-digit increases year after year. As they squeeze independent providers with lower reimbursements, we lose pharmacists and technicians. We lose doctors and nurses, leading directly to decreased quality of care. The numbers don't lie. America spends more on healthcare than any other nation, yet ranks dead last in outcomes among wealthy nations. Let me tell you a story about a gentleman named Cole Schmidtneck. This 25-year-old was living independently when his insurance renewed last year. Suddenly, his PBM would no longer cover his generic inhaler, instead requiring a brand name version that generated rebates for them. In December, Cole's inhaler cost $50. In January, before meeting his deductible, the same medication would cost over $550. Cole chose to pay his rent instead of buying his life-saving inhaler. Days later, he suffered an asthma attack and died. Some Illinois legislators may recall meeting Cole's father during our Illinois Pharmacy Legislative Day, where he passionately shared his family's story in support of PBM reform. Although Cole was a Wisconsin resident, His tragic experience underscores how harmful PBM practices know no state boundaries and why action is urgently needed here in Illinois to protect all patients. The Prescription Drug Affordability Act won't solve everything overnight, but it takes crucial first steps. First, requiring PBMs to pass all rebates to patients and payers instead of keeping them as hidden profits. It ends patient steering to affiliated pharmacies that prioritize corporate profits over patient choice and care. It pulls back the curtain on spread pricing schemes that allow PBMs to charge health plans or the state one price while paying pharmacies far less, pocketing the difference as profit, an opaque and exploitative practice that drives up costs and fuels pharmacy closures. You have a choice. Stand with patients like Cole, or allow 3 Fortune 500 companies to continue to enrich themselves while Americans die. The problems with our healthcare payment system are real, and PBMs are the poster child for what must be fixed. If we don't act, healthcare costs will continue escalating while quality deteriorates. Please vote to pass this bill and commit to fixing our broken system by regulating the monopolists who put shareholders' profits above American lives. A vote for this bill is a vote to hold powerful corporations accountable. For too long, PBMs have operated without oversight, exploiting patients and draining our healthcare system of resources. The Prescription Drug Affordability Act is a crucial step in restoring balance, fairness, and trust in how medications are priced and accessed in Illinois. And by the way, County Market just announced today that they are closing the 4 pharmacies that they have in the Springfield area. It's been rumored for a while, and they announced it today. Pharmacy deserts are growing. Thank you.